They are among the most popular drugs in this country. Antidepressants. 164 million Americans take them every day. But a new study is suggesting antidepressants might not be all that helpful to a lot of people. Let's talk about it with Dr. Manny Alvarez, managing editor of FoxNewsHealth.com and a member of the Fox News Medical A-Team. Doctor, were you as surprised as many observers seem to be about the results of this new study?
No, to tell you the truth, I was not. This is a topic that we have been monitoring for quite a while, and as you just said at the beginning of the piece, 164 million prescriptions. And the latest survey, which came out of Johns Hopkins, looked at about 60% of the population is taking more than 2 drugs at a time. So the utilization of antidepressants is quite high, but now this is probably the second study, very good study, published in the American Medical Association Journal, that is saying mild to moderate depression really there's no benefit in taking antidepressants per se. It seems to be effective in severe depression, which really constitute about 40% of all patients. So I think that we're over-medicating. I think we're utilizing these drugs in perhaps patients that do not need them. And at the end of the day, we have to look for better alternative treatments, especially in cases of mild to moderate depression.
In researching this story, I was going to ask you how you know whether you have severe depression or not, and I was surprised to read that there actually is a rating scale for determining that.
Oh, absolutely. You know, the clinical diagnosis of depression done by physicians and psychologists is very strict, so there's a specific criteria. But you have to remember what is happening is that through marketing of pharmaceutical industries, you see a lot of commercials now sort of telling people if you feel this way or another way, you may have depression, talk to your doctor. A lot of folks don't go to see a psychiatrist or a psychologist. They might go see a primary care doctor who may not be in tune with the proper diagnosis of the severity of a depression, and therefore the easiest thing to do is just to prescribe a medication.
And one of the suggestions coming out of this study is that some of these patients who do suffer from mild depression, yes, they got better as a result of taking the pills, but the suggestion is that in taking the pills, they were also spending a lot of time talking to their healthcare professional, and just that talking, just that, maybe mild psychotherapy may have been part of the solution here.
Oh, absolutely. When people are involved in a clinical trial, as these folks were, the investigators are very well in tune, making sure that they don't report any side effects, asking questions every day, do you feel better, and things of this sort. So that, involvement by the medical community is helping. And this is exactly what a lot of doctors are saying. Look, we have sort of walked away from psychotherapy, from talk therapy, music therapy, exercise. All of these things help tremendously in patients with mental illness, and we have to get back to those fundamentals.
Okay, but let's say you're a patient who's taking one of these antidepressants for mild depression right now. Maybe you don't want to stop. Maybe you feel like the thing is working. Is there a downside to taking that medicine?
Well, look, there's always side effects. If you look at the side effects of any of the SSRIs or any of the older medications, you're going to see multiple things, right? Including recently there was some warning for adolescent depression that these drugs may give suicidal ideation. So there's a lot of significant side effects. If you're taking the medication under medical supervision, I wouldn't stop. I would just go back to the doctor and say, by the way, I just read that maybe my case is a mild case of depression. Should I be on this med? And have that conversation. Don't do it on your own. But clearly, this is a wake-up call for future studies and also a wake-up call to a lot of doctors that maybe were overprescribing these types of drugs.
The head of our medical A-team, Dr. Manny Alvarez. Doctor, thank you.